Hello, this is Lucas Arriola from Digital Health Trends from America's Continental Health Alliance. We are thrilled to have with us Lucia Pannese from Imaginary. Today we will be exploring innovations in the realm of digital health and learning more about the solution they are offering. So welcome, Lucia.
Thank you, Lucas. I'm very delighted to be here with you.
Thank you very much. Well, Lucia, you can talk about your company, your product, and make an introduction for us.
Okay, thank you. So I founded Imaginary in Milano, in Italy, about 20 years ago, as one of the first companies to specialize in serious gaming. These are video games for purposes different from entertainment. We have participated in really a lot of EU-funded research projects over those 20 years and created games for training, educations, and healthcare, wellness, and so on. Until 12 years ago, we started concentrating more and more on the topic of telerehabilitation, which is now, in the meantime, our core business. Because we really believe that these games can transform healthcare for the 21st century and address many of the challenges that healthcare systems globally face today. The solution is called REHABILITY, and it faces the challenges that healthcare systems globally are presented with today, which is a high shortage of resources versus an increasing number of typically chronic patients who are in need of rehabilitation. Typically, these patients receive late therapy and therapies are too short. So sometimes they really have even new occurrences. And this whole situation is creating an enormous stress and great costs to NHS systems. At the same time, they are creating a societal challenge because these people often lose their jobs or are not able to work for longer periods, as well as their quality of life is, of course, quite poor. So we wanted to face this challenge with a system that clearly needs to be asynchronous so that we optimize time that therapists dedicate to their patients, and patients can train from home when therapists decide that these patients can do that. So if the patients comply with inclusion criteria that the clinic has to decide, and the therapy happens through games. So games have been co-developed typically with patients between 60 and 95 in our research projects. And what we did was translating almost one-to-one the physiotherapy and the cognitive stimulations that patients receive in traditional therapy and embed that in a way in graphics so that they are presented with functional tasks that are set like games. Games that these kind of patients can refer to and that motivate patients to adherence. So they would train both motor and cognitive functionalities playing a game and receiving very, very simple feedback as to what they're doing, while in the background, data are collected for the specialists to dive deeper into the progress of a therapy and in case change it.
Absolutely exciting. What are you doing? And you've been in a role for a long time. You said you put the patient in the center because you co-designed this kind of games with the patient. So that is something that is very important. And well, I think you have, and you named that you make some studies. So I will ask you for the validation and evidence that you have. Maybe you can tell us something a little about it. And then sometimes you can talk about the benefits or the successful stories that you have.
Yeah, thank you. Well, we have today, I think, 23 published scientific papers, and evidence tells us that patients are very, very motivated to use our system. So they often prefer it to normal therapy and would suggest it to their peers. As far as efficacy is concerned, efficacy is exactly comparable with traditional therapy because, of course, you have to preserve that possibility and opportunity for a patient to get the best possible therapy that is available today. while motivation is then enhancing adherence. For example, the most recent paper that appeared, I think, about 1 week or 10 days ago in Spain, in Bilbao, was showing that Parkinson patients get even more fluid in their movements. And that might seem strange, but the trick, if I may say so, is that patients are delighted to do the therapy based on games. So they stick to the therapy. They don't stop exercising. And because they are exercising more, they can even get a little bit more fluid. So these are the benefits that patients can get, together with the fact that they can train from the comfort of their own homes without having to drive or normally be driven to centers, which is sometimes some place which is far away.
Well, excellent. So, talk about some security issues. About, I think you collect data from your patients when you do this kind of treatment, tele-rehab treatments, and how is Imaginary dealing with safety issues and security issues that they are very important for the new adopters or something like that.
Of course. Well, safety, of course, the system was trialed in very many contexts with different clinics and different types of patients and so on. And anyway, the therapy stays in the hands of specialists. So it is the specialist who decides for each single patient which kind of exercises to put into a therapy plan, which is highly personalized. And every exercise, so every game in our system, it is based on parameters. So everything is really fine-tuned to the patient. So the duration of the game, the speeds, the width of movement, the direction of movements, and so on, so that it is safe as well as useful, of course, for the patient. In terms of data security and so on, of course, there are norms. We are in Europe, so there is the GDPR and so on, and we stick to the rules. So we follow everything that we have to guarantee security. That's fundamental. On top of that, we have to remember that we do not have any patient's record in the system. So it's games data that we have there. So of course, they are related to the therapy and the progress of a patient. So this doesn't mean we are less careful, but it's not, nothing is strictly pathology related, if I can say so.
Okay, so you are in the terms of data, you are GDPR compliance, and
we have to, of course.
In the term of certifications, you are validated as a
CE medical device.
Excellent, absolutely.
In neurology for stroke, MS, Parkinson's, and spinal cord injury. Plus, we have 3 other new pathology lines in trial right now, and these are long COVID, chronic fatigue, and Pompe disease. Oh,
so you are improving and making wider aspects of the rehabilitation and including everyday new pathologies.
Types of patients. Yeah.
Excellent. That's awesome. Well, what are the future developments or future? What are you thinking about the future of rehab or Imaginary? What are you planning for the future?
Well, we really believe that the future of rehab and of healthcare in general will see more and more digital implementations and digital supports. That's clearly what we think and believe strongly. So we are enlarging the base of patients that we can serve with our system, as I said, through new trials. We are also trying to secure new research projects to create new versions of rehability. We have a prototype for rehability cardio, for example. We have a rehability kids version that has to be validated. So we will create twin products, if I can say so, that will always be very, very pathology specific. That is also fundamental in our opinion. And we are at present internationalizing a lot what we are doing. The system is already in 16 languages. It's available in several countries already, and we are trying to find new partners and distributors for new countries so that they can support the business phases in their own countries, in their own languages, and we can back them up from the office in Milan.
Excellent, Lucia. Incredible. It's thank you very much for sharing with us all this valuable information. To our audience, we can say that we can get in touch with us in our links or in our profile that are going to be posted with this video. Thank you everyone for following us here with this video cast from ACHA, and thank you very much, Lucia, for being here with us and for your time.
Thank you very much, Lucas. And for those who want to have a look, they can go on www.rehability.me and they can have a look at the little video, the bibliography, and some details about our product. Thank you.
Thank you very much. Bye-bye, everyone. We'll see you in our next episode.